Dr. Bill Adams here. This is No Spin Live, and do we have a show for you today? We're going to talk about a buttock implant linked to a similar lymphoma that's known around breast implants, and then 7 facts that you should know before thinking or having plastic surgery. And we've got 3 incredible international experts to give you their insights. We've got Dr. Jason Pozner from Boca Raton, Florida, Dr. Chet Mays from Louisville, Kentucky, and Dr. Dan Del Vecchio from Boston, Massachusetts. All right, let's get into it. So this first story, breast implant ALCL is something we've been talking about now for 9 or 10 years, but more so in the past 3 to 5 years. This is the first case of ALCL case in a buttock implant. Jason, why don't you lead us off on this one?
You know, it was really interesting when I saw this, because this is the first time that I heard about this. So it makes sense a little bit that it's entirely possible to me. So you have a textured implant in an area that could potentially have biofilm, and it could be the same type process that's related to breast implant ALCL. But again, you know, one case doesn't really mean anything, but if we do see more cases of this, then it's something that we really need to evaluate. So again, you know, Dan's going to talk about the sterility associated with all of these implants, but I really think that it's something that, hey, we don't do a lot of buttock implants in the US. We do way more fat grafting. And should we be using smooth versus textured buttock implants? I don't do either one, do some fat grafting. So I think I'm going to leave this in Dan's hands, the expert, to really comment on this.
Well, Chet, what do you think?
Yeah, no, I agree with Jason. This is the sort of case report, and you're always interested in case reports. But I mean, the concepts are there, just like Jason talked about, the environment, the type of implant. When it comes to breasts, I'm much more versed on sort of when to use smooth, when to use texture, that whole discussion. But as far as buttock implants, you know, smooth versus textured, I'm not sure what the benefits are. So I'd like to refer to Dan on that, just based on his experience with implants. But I agree with Jason about more fat grafting here in the U.S. for our Brazilian butt lifts. But it's definitely an interesting case and worth bringing up for all of our discussions on ALCL. It's a very, very hot topic, not just for plastic surgeons, but the media has sort of blown this up now. We have patients talking about this, so definitely worth us discussing.
DDV, I'm sure you have a lot of good stuff to say about this. So what's your insights?
Insight number 1, buttock implants are much more challenging than breast implants in terms of putting the implant in without contamination. Can you imagine if there was like a butthole where your manubrium sternum was, or your xiphoid bracket? You would have a lot more infections and probably biofilms and contamination. It's challenging. The incision is really close. Frankly, I'm not surprised that there is a case of BIA-ALCL. If you believe in the biofilm theory, my gut would tell me there's probably many more that are just treated by removal of the implant, and patients who present to their surgeons with seromas could have had BIA-ALCL, and just by taking the implant out and draining the seroma, they might have just kind of gone away. But I would guess that this happens more than reported, because there are a lot of patients who present with seroma after BBL, late seroma, and the implants are removed.
And the interesting thing about this case was it manifested or was diagnosed at a year after placing the implant, which is far shorter than what we're seeing in the breast, which is 8 or 9 years. But that may just be exactly what you said, Dan, about it may just be a function of the bacterial load, because it may just be a very high load that was around that particular implant, which is going to cause a much exponentially higher amount of chronic inflammation, which we know may contribute to this. So.
Agreed, and could it potentially accelerate the progression of BIA-ALCL? I agree completely. I wouldn't be surprised if we see more cases like this pop up over the next year.
And Dan, also, buttock implants, although, in the United States it's been less used, certainly fat grafting has been the mainstay for buttock augmentation, but now I think that composite buttock augmentation, I think you've been educating people on that, so it's probably something that's going to be more popular, don't you think?
Yeah, I think the use of a small implant, smooth round, and I think that we touched on this earlier. We said we're not sure why they're textured. They're textured mainly because the ones that are elliptical, we don't want them to rotate. But with a small implant, just like in the breast composite kind of concept, with a small round buttock implant that's smooth, you don't need to be textured. So that kind of takes away that issue. But, 150 or 200 cc small round implant just in the center of the gluteus muscle surrounded by fat, it's a home run. Just like core volume could never be achieved with fat. And Bill, you were the first to say core volume projection is very difficult in some cases with fat alone in the buttock.
Agreed. Well, listen, those are great. Let's move on to the second topic. This is something that was just put out, kind of the 7 facts that you should know before opting for plastic surgery. There's some that looked reasonable. There's some that looked a little odd to me. But Jason, why don't you lead us off on this one?
I don't know. I thought it was like a comedy sketch when I saw the video about 7 facts of plastic surgery. So, I think in the U.S. we look at things a little bit differently. That I think the main take-home message from this video was that plastic surgery is a real surgery, and that real complications can happen from real surgery, from blood clots to infections to other things. Even though these type of problems are extremely uncommon in plastic surgery, there are certainly things that we need to be aware about before embarking on a real plastic surgery.
They're not absurdly wrong, but things like organ damage, there's probably 100 other things that are more relevant to put on the list before organ damage. But what do you think? And maybe what do you think the most important things for patients to think about or make sure they check off before they embark in plastic surgery?
Right. It's about education. Starts out with board certification. No matter who you're going to for the specialty, you want to ask your physician, are they board certified? When it comes to plastic surgery, I want my patients to ask me, are you board certified? And I'm like, yeah.
Board certified in plastic surgery, not
Correct.
board certified in emergency medicine or something.
Right. If we're talking about cosmetic surgery, then yes, board certification in plastic surgery. But things outside of surgery, I'm just saying, I always ask my physicians about their board certification. But yes, definitely when it comes to plastic surgery, are you board certified in plastic surgery? And if the answer is yes, then you've found a doctor who's been credentialed by the American Board of Plastic Surgery, and then you move forward. But it comes about education on patients, realistic results. When you're having discussions with patients, no matter what the procedure is, you want to give them realistic expectations on what their outcome can be. And a lot of times you fall short if you sort of oversell your procedures and don't really give them those realistic expectations. Or you find patients whose expectations are way over top, and you realize, they're coming in and showing you a picture of an 18-year-old and they're 65. You're like, I'm sorry, but you will never obtain that result. And if you sort of stick your ground and give them those realistic expectations, I think you find yourself more successful than not in most situations.
DDV, what are the pearls for a patient that wants to have plastic surgery? What do you think the most important things are?
If I'm a patient, I don't know jack about plastic surgery, I'm doing a Google search, a real self search. I'm looking for board certification. I'm calling the state board to see if he's been disciplined or she's been disciplined. And lastly, I might even do a national practitioner data bank to see how many times the doctor has been successfully sued or had a settlement. It's amazing how the 4 things or 5 things I just said, nobody does. The things that they're more interested in are price, how many followers you have on Instagram, and other like incredibly useless pieces of information. But the 4 or 5 that I just gave you are really important and often never done.
Dan, can I comment on that too? Is I think one of the things that patients don't realize is how many times a certain physician does a certain procedure. Like, we know that Dr. Del Vecchio does a ton of buttock augmentations, okay? I probably wouldn't go to Dan to have my trigger finger fixed at this point in your career. You probably haven't touched a trigger finger in 30 years, And the same thing with Bill. If you want an excellent breast surgeon who lives in Dallas, Bill is your man. But there's certain things that we don't do in our practices. So I think you really need to ask your doctor when you go to your consultation, well, how many of these do you do?
Right.
Are you the right person for this? Or if you don't do this, I'll come to you for something else. Who should you refer me to who you would send your sister to?
I think that's a really good point, Jason.
Yeah, I think that is a good point. And it's important, that board certification and by a BMS board in plastic surgery is definitely a good start. But, you do need to differentiate who's an expert in that subgroup, because there's clearly people that have a special expertise, and I think that there's no doubt that somebody, if you go to Dan for a buttock augmentation, you know that you're going to be going to the best, and I think that the more you do, the more efficient you're able to do it, the better the outcomes, the less complications. I think the only other thing I would say is that it's really hard, I think, for patients to figure it out, because it's not, you can do a Google search, a real self-search, or you may not get lucky and find the information you need. And the only other thing I would add is that somebody should just check to make sure your physician has hospital privileges to do the procedure, especially if they're doing it in their office, because I think there's a whole group of surgeons that aren't board-certified plastic surgeons. They're usually these other cosmetic surgeons that are doing, that are sometimes not trained in surgery that much, and they don't have hospital privileges. So that's one kind of roundabout way you can figure out what your surgeon's training is. All right, listen, that's great stuff, boys. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.